Hello and welcome to episode 12 of VetPhysioLife. I'm Shane Jasani and I'm joined as always by Kim Sheeder. Hi Kim.
Hello.
So Kim, it's Friday and this was a shorter week because of the bank holiday. So I thought we would just chat a little bit about some of the highlights from the week, if that's okay.
Yeah. So lots of my regulars still. A couple of ones I haven't seen in a little while. So I saw a little Dachshund who I've been seeing sort of every sort of month to 6 weeks for the last little while. He is 14 and he had a neck problem, neck pain. It was suspected that it was going to be a neck disc, but he had an MRI a few years back and it wasn't significant enough to warrant surgery or anything like that. So he's had physio and he responds quite nicely to it. So was doing an end of summer sort of top up basically. He does he's another typical, he does well in the summer months where it's nice and warm, and then as it gets colder he gets a bit stiffer. So we were having a little look before it started getting properly cold. So he did well. He's absolutely lovely. He has two other brothers and sisters that are also Dachshunds that get very jealous, and it's very, very funny. And I end up with, actually I think there's been a photo of me with three Dachshunds on my lap because the other two are trying to go, what about me? So yeah. So I saw him.
He's 14. That's pretty impressive, isn't it?
Oh, I know. Very impressive. Yeah.
And no disc problems anywhere else in his lifetime?
No. Amazingly so. He's done very, very well, I have to say. One of his brother has had a hemilaminectomy in the past, but just the one, and he's doing brilliantly. You wouldn't notice any deficits. And his sister, who can't quite remember how old she is, but they're all around 14. They're all sort of they were all turned up at the same sort of time. She's had no problems at all, touch wood, etc. But yeah, so they've their owner obviously knows how to look after Dachshunds very well.
Do we have, like on a serious note, do we have any idea why some Dachshunds get these problems and others just don't? I mean, I know we've talked in previous episodes about breeds that are predisposed and so on, but...
Yeah, so obviously Dachshunds are one of the breeds that are predisposed to disc problems. No, officially there is no one knows the things that, why some are more predisposed than others. From my point of view, just thinking about it, I personally have a suspicion it's to do with the use of stairs, and being allowed to jump on and off furniture. I mean, again, I've got no proof, but using educated sort of guesswork, for want of a better word, the jumping off, when you jump off, when a dog jumps off something, it lands on its front legs and the rest of its body then follows. There has to be quite a significant, I would imagine, compression force going through the spine at that point in time. And if a disc is going to bulge, it's going to bulge when it's under compression, not when it's under tension and being stretched. So I would say prevention of jumping off things, and potentially prevention of going up and down stairs is probably the only things that you could really do. But at the end of the day, you could do that and they could still get disc bulges and disc prolapses. So it's difficult to say, but certainly these dogs do live downstairs consistently and they're not allowed on furniture, so possibly that does have something to do with it. I don't know.
Yeah, that's interesting, because I guess if you were counselling a carer that's just got a young Dachshund, let's just say, or a puppy Dachshund, then I guess if you can get them not used to jumping in furniture and climbing stairs from a very young age? Because I guess some people would say, well, what if they enjoy jumping on the sofa and climbing the stairs? You don't want to deprive them of that sort of pleasure. But I guess if from a very young age they're not used to it anyway, then maybe you're not really depriving them of something that they're missing.
Absolutely. And if you want your Dachshund to be able to join you on the sofa, there are actually some...
Sorry.
This is going to sound... Yeah, go on.
You're
going to laugh at this. So you can actually buy little stairs or little ramps, etc., that don't look hideous, that you can use to allow them to get on and off the sofa. And if you teach them to use them from a puppy, then they're going to be more likely to use them than trying to jump on and off, if you're determined. And as far as stairs are concerned, it's not like going up and down stairs in itself is a pleasure to the dog. So and Dachshunds are small enough that you can scoop and bring them with you. So, there are ways around it potentially, and you could still have the same lifestyle, if you see what I mean.
I do, yeah. And we'll move on, but if you ever come across a house where there are some stairs for Daxies to climb on the sofa, you've got to get me a picture.
Okay.
I'm sure you can improvise on other things rather than...
Oh, yeah. Well, a couple of footstools of different sizes, that sort of thing, but yeah. Anyway.
All right, cool. So who else did you see?
Who else have I seen? I've seen, so I saw one of my regulars, a Cocker Spaniel, who, so she had a hemilaminectomy many moons ago, and she's actually fully recovered from that. She's got some arthritis in her knees, in her stifles, which I suspect is probably from a cruciate ligament, but it's never been investigated. Because she also has respiratory problems. So she has she gets recurrent pneumonias, which I suspect is from laryngeal paralysis. So your larynx is the voice box and the vocal cords, and something that you can get in dogs is that, and humans, but less so, but is that what they should do is be able to contract and relax, and that's what makes the noise as we speak to a certain extent, and as dogs bark, etc. And what can happen is one half of those, or potentially both sides, could become paralysed, and then they don't shut. So when the dog is trying to eat, normally when you swallow, your larynx closes off and prevents food from being inhaled into your windpipe, into your trachea and your lungs. And if they've got a laryngeal paralysis, then they might inhale little bits of food into their lungs, and then that gives them chest infections. So she had been doing very well, but in the last few days has been coughing a lot more. So I actually ended up doing less massage and laser with her, which I normally do, and more breathing exercises and some physio. So you can, despite the fact that it sounds weird, you can actually get dogs to do breathing exercises, but mainly by just getting them to bark. So the way to do breathing exercises in a human is to get them to do a big deep breath, hold it for a few seconds, breathe out, another big deep breath, and you repeat that 3-4 times. Then you get them to give a cough and help clear the secretions. With a dog, if you can get them to bark at you, then they have to take a deeper breath in order to be able to bark. I'm quite lucky in that this dog is absolutely delightful, but she's very, very vocal and can be a bit grumpy when she wants to be, so she barks quite easily. So we managed to get her to cough and clear a fair bit yesterday.
How do you get her to bark, though?
Just mainly by getting her to move. She didn't want to move, so she was just shouting at me. So, yeah. So she's
so fascinating. I was like, that's just so interesting. Like, I've never really thought of that. That barking might have some sort of physiotherapy related effect.
Yeah, absolutely. Absolutely.
Very
You
cool.
got to be creative when you can't ask them to take a deep breath. So there we go. She didn't want to move from her spot. So a little bit of gentle encouragement to get her to move, and she started shouting at me quite a lot. So that was brilliant because she then started coughing and clearing. So dogs, again, very similar to children in that they can't spit their phlegm out. So they cough and then they swallow it. But if they swallow it, that's absolutely fine because that just goes into their stomach, and to be crude, it comes out the other end eventually anyway. So it's absolutely fine.
Very cool.
Yeah.
And so who else did you see?
Excuse me. Speaking of coughing and clearing, blimey. So who else did I see? I saw my 14-year-old Labrador with the elbow replacement. He's doing all right at the moment. He has just had his steroids upped a little bit, and that's obviously helped with his pain control. He's unfortunate in that he has quite a lot of allergies to various different things, and that includes pain medication, a lot of the pain medication. So steroids are about the only thing he's able to have. But yeah, he's doing okay currently.
What's his weight like?
He's not bad. He's a little bit, I would say he's on the large side of normal, but he's not overweight by any stretch of the imagination. His owners are very aware and are very careful with what he eats, and much to his disgust, because he's A, Labrador, and B, on steroids. So bless him, he's trying to eat anything he can possibly find, but he's doing okay.
It's a tricky one, isn't it? Because steroids wouldn't be our first choice of drug for pain relief by any means, but and they have all these side effects that aren't necessarily very helpful.
Yeah.
But it sounds like it, from what you said, it's his only option, really. So.
Yeah, it totally is. He's tried all of the other non-steroidals through to just painkillers, etc., and he reacts adversely to all of them. So yeah, steroids are as the only thing we can use with him. So yeah, as you say, it's not ideal, but it's keeping him going with a reasonable quality of life at the moment. So yeah.
And so, Kim, at this time of the year, is it generally a case of people are back from holidays and you're sort of maybe seeing some patients to reassess them after the summer, but see how things have gone? And is there a bit of that going on at the moment?
Yeah, it's only just starting, but yeah, September is usually the month for catching up with people, both because they've been on holiday and also because the warmer months, lots of dogs do better, whether that's purely the weather or whether that's because their owners are more active and keep them more active so they don't get a chance to stiffen up, or a combination of both. I suspect it's a combination of both. I'm not sure, but September, as it starts getting chillier, they'll all start phoning me up and saying, "Can you come and have a look?" Because they get stiffer, and it is noticeable that there'll be a dip with the first sort of true lot of cold weather that comes in as and when it does. So yeah.
Cool. And actually, when you were talking about the Cocker Spaniel with arthritis, my mind went to this advert that's on the TV at the moment. It's about arthritis in people, obviously, but I mean, we've done previous episodes on that. I don't want to talk about it in detail, but I guess it's a big problem, not just in people, but also in dogs and cats, right? Like, do you think we just underappreciate just the true extent of the impact it has on animals in general?
Yes, totally. I think we underestimate the impact it has on every mammal, full stop, whether that's human, dog, cat, or anything else. Osteoarthritis in its truest form is as much as it's wear and tear on the joints. Now, that's not necessarily anything to be scared of, but you have to accept that will happen if you get old enough and you use something for long enough. Everything wears out eventually. Sadly, we're no different. Now, that's not to say that you need to modify your life or your animal's life too early or anything like this. But if you know there's an increased risk, then there are different things that you can do accordingly. But I do think that we underappreciate it. I think probably especially in cats, because they're so difficult to assess for pain. But also, I know a lot of certain breeds of dog that are incredibly stoic, and you just don't realise how sore they're likely to be, because they can't communicate to us. And if they're stoic and don't show their pain, which, can be some Labradors, some Border Collies, any breed of dog, in fairness, but there are some that I found more consistently. I think they're probably the two that I found most consistently. You just don't know how sore they really are until it's like the straw that breaks the camel's back. They keep going, and then they're just like, no, I really can't go anymore. And then you realise how bad it is, and you think, how long have they been in pain, unfortunately. But it's really difficult as a carer if they're not showing you the signs. Even as a medical professional, it's difficult to assess and difficult to decide on. So it's not something that you as a carer are doing wrong necessarily. It's just really, really difficult to interpret.
And so not to go back to this TV advert, it's so striking to me. Because the man that they sort of feature in the advert is quite young, actually, which is I think is why it stood out to me, really, because I thought, I think of arthritis and osteoarthritis, and I tend to my mind tends to go to older people and older animals as a sort of reflex response. But this guy's actually quite young. And do you think we see that in dogs and cats too, that maybe we don't recognise the true sort of, prevalence of arthritis in younger dogs and cats, and maybe it's not obviously causing them a problem, but somewhere it's kind of there.
Yeah, and I think that's the ones that I was talking about probably mainly as the straw that breaks the camel's back. It's that if they're young and fit, then they can disguise it a lot better. And you don't know about it until much later. The only way you're going to get arthritis in a young animal is if there was a predisposing factor to cause it. So you tend not to, almost across the board, you tend not to get primary arthritis. There's always it's usually secondary arthritis. So that just means that there's a primary problem, and then arthritis comes along as a result of that. So that could be, in dogs, the most obvious things are, in younger dogs, the most obvious things are hip dysplasia and elbow dysplasia. And then other than that, it's things like fractures that have affected a joint or are very near a joint, and any surgeries that go into a joint. So ironically, although with things like the surgeries to help cruciate ligaments, and while they in themselves are necessary, because a ruptured cruciate ligament will reduce the stability of the joint, and the reason we do the operations is to restore that stability and prevent arthritis. Actually having to go into the joint itself will in and of itself cause arthritis at some point, but it's the lesser of two evils, because it will, the working theory, which I thoroughly believe, is that if you can stabilise the joint and then strengthen it with physiotherapy afterwards, you are going to, the onset of that arthritis will occur a lot later than if you've got a constantly unstable joint that isn't able to support itself.
Yeah, that makes sense. Cool, very interesting. Well, I'm sure this is a topic we're going to come back to a lot in the future. But cool. Well, before I let you go, we were chatting before about that you're off on a course this weekend.
Yes, I'm off down to Taunton to have 2 days learning chiropractic techniques for dogs. So that will be quite interesting. And
so could you just kind of, I guess, explain in basic terms what the difference between chiropractic practice and physiotherapy is, or are they a subset of each other, or how are they related?
No, so I'll probably be able to tell you more next week after I've been on the course. But my current understanding, which I have to say is quite very basic, probably actually, is so the use of chiropractic is joint manipulation. So with a physiotherapy, physios, we use joint mobilizations. Now, it doesn't sound any different, but bear with me. So every single joint should have some movement in it. So a joint is basically one bone on another. So it's two bones joining. There's a capsule around it that incorporates these two ends of bones, and they move about each other. That's the most basic way of discussing a joint. So every single joint, as well as just being able to, for example, bend and straighten your knee, while we as beings, when we are bending and straightening our knee, we don't actually know it. There's actually a little bit of other movements going on in there. So there's actually a little bit of rotation specifically in the knee, but it can be other movements. So what we do as physios is, if you've got a stiff, sore knee, we will hold one bone still and move the other bone in a rotation to try and restore those little movements that you don't necessarily even realise are there, but are very necessary to stop pain and stiffness in the joint. So while we may not be, so we do it gradually and gently, and we do it at grades. So we grade all of these mobilisations. So we do them grades 1 through 4. So they are all grades. I'm not going to go into what they mean, but they're all grades that if it starts really hurting while we're in the middle of doing it, the organism that we're doing it to can tense their muscles and prevent us from continuing. Chiropractic, as I understand it, only works in grade 5, which means it's a manipulation rather than a mobilisation. Yeah. So that's when they put you in a position, wind you up, and then it goes, and then do a quick movement, and you can't stop that joint movement. So I'm sure people have been to the chiropractor, so it's sort of, they put you in a certain position and then go 1, 2, 3, and it goes crack. So that's the difference. So it's just a level of, not necessarily force, but it's the biomechanical, how we prep you, basically. Yeah. But you can't necessarily stop a grade 5, whereas the organism can stop a grades 1 through 4. Now, that sounds terrible, but there are reasons why you would choose to do those more. So at grades 1 through 4, you need to spend time and repetitiveness doing it again and again and again. Whereas a grade 5, you can do it once and that's it, and it's done. So sometimes there are some instances when it's better and potentially kinder to do one quick painful thing than put anyone, human, dog, cat, otherwise, horse, whatever, through 3 or 4 minutes of slow and painful, if you see what I mean. So there are reasons that you choose different things, and that's why I'm going off to learn about it more and see if it's something that I want to incorporate or can incorporate into my daily practice.
Well, I think that's fantastic, because it's kind of lifelong learning, new learning, giving everything a chance, seeing what you think about it, etc. is just the name of the game, as it were, really, when you're a
absolutely you have to
person.
Yeah.
That's very cool. So we'll absolutely catch up next week and see how you found it all. Sure.
Cool.
I think it's also just, because someone in your position that's so kind of, I'm going to blow your own trumpet now, but so so qualified, experienced, and so on, to be going into an arena where you're sort of listening and learning off others rather than being the person that's actually teaching. It's like it's a different place to be, isn't it, really? So
it's a really different place to be, but it's really helpful, and it makes you go back and think about what you're doing currently, and can only, even if I've been on courses where I've come away and gone, okay, I don't think I'm going to incorporate any of that, but it has made me, forces you to reflect on your own practice and what you're doing, and if there are gaps in your knowledge and what you can do better. So yeah, I do always try and do 2 or 3 courses a year if I can, money and time permitting. Obviously, that's the biggest things, but it has to help your practice in the long term, definitely.
Well, and I'll tell you what, Kim, like, so since you and I have been working together because, I mean, many of the audience will know by now that I'm a specialist in emergency and critical care, right? So it's the kind of area, and it's a very broad area, but nonetheless, you know, talking to you and learning some more about physiotherapy and stuff, I found that just a really enjoyable experience because it's kind of all new. I sort of have some basic ideas, but like, yes, I think, yeah, absolutely. Kind of exposing yourself to new learning information and then having a view on it is kind of a really good thing. But, I'm going to stop and let you go because I know you've got a lot to do, and have a great time at the course, and we'll catch up after the weekend. Yeah.
Thanks. That's great. Yes.
All right. Take care. Cheers, Kim. Bye.
Bye-bye.
Bye.